We've made it to the end, and it is kind of bittersweet for me, I must say. I am happy to be done, but I am sad to have to be done, if that makes any sense at all. So, I'm going to tell you a little bit about my experience here in this short PowerPoint I have. So, the questions that Dr. Fisher wanted me to answer, and the rest of us, I'm first going to start out with tell us what you set out to do and what you did do and what the journey looked like along the way. So I had kind of two pieces to my practicum, and I'm sure most of you kind of had the same thing going. But I had my assigned project that I was supposed to do over the summer, and then I also had the opportunity to act like a shadow and kind of learn at the professional level of what's going on in healthcare with quality. So, first I'm going to go over my project. Let me go back here a second. The area that I was focusing on for this project is the Fargo region and the Bemidji region. This these regions report together their data. So I was working from Fargo, but I was also working with Bemidji since they have the greatest number of American Indians seen at their facilities. All right, so I'm going to get into the data. So the first thing I did right away when I started in May was I requested a report for all non-Caucasians eligible for colorectal cancer screening that have been seen in a Sanford facility in the last 12 months that are located in Fargo and Bemidji. Now, I know that was a mouthful, and we all know that we need to have specified parameters in which we collect our data. Otherwise, we just get so much that we can't use because it's just so much and so broad. So this yielded me about 970 patients that hit this report, and some topics that I had pulled with this report was like, when was their last colonoscopy? Are they overdue on their colonoscopy? Did they have some other sort of colorectal cancer screening test besides colonoscopy? So like a flex sigmoidoscopy or a fit test, which is basically a little... The patient actually has to take and wipe their stool on this little card, and then they send it in the mail. And it gets sent to a lab where they do a test on it to see if there's any blood in the stool. That is not a cure-all, but it is a easier way to get people to get screened instead of going through the hassle of a colonoscopy. Now, colonoscopy is the gold standard in healthcare, and we wanted to make sure that we were pushing colonoscopy versus fit test because, of course, we wanted to hold people to the gold standard in healthcare. So some other things I included on that study were like clinical characteristics such as blood pressure, A1C levels if it was applicable, any diagnoses that they had. So I put heart failure, COPD, asthma, what else? Depression, and I think there was a couple others on there. But I also did no-show rates where patients would, if they scheduled an appointment and then they didn't show up without canceling it. I also did cancellation rates, and then I also looked at how many primary care providers that they had, how many primary care provider appointments they had, how many ER appointments they had, and how many walk-in clinic appointments that they had, just so that I could get a really good idea of how were these patients even coming to the clinic or hospital. I mean, were they taking care of themselves? I just really wanted to get a broad picture to see what kind of population was I dealing with and how healthy the American Indian population within the Sanford system was. So I did some biostatistical calculations, mostly the t-test. I used on and then some epi studies looking at locations of if there's any centralized location of where there's a population that's overdue, or so on and so forth. So here I'll give you a little the results of my data manipulation. So this one was my clinical characteristics of the people that are overdue. This is specifically American Indian. So what I found was surprising was in all of my testing that I did, the only two variables that were statistically significant in my comparisons was age and no-show rate between those that are overdue and those that are not overdue in their colorectal cancer screen. Overall, though, the population was very healthy. As you can see, they have a really great blood pressure in both the up-to-date and overdue populations. BMIs are pretty close to the same, and then their A1Cs are great for those that are diabetic. So this was really reassuring to know that the American Indian population within the Sanford system is very healthy. Next, I looked at risk ratio of if a patient had a diagnosis of hypertension, diabetes, heart failure, COPD, depression, asthma, or they had a family history of colon cancer. I wanted to see if they were at greater risk of being overdue. And as you can see here, the 3 statistically significant diagnoses were diabetes, heart failure, and depression. Because they, if you remember back to Dr. Strand's class, they don't cross over the 1 mark, so that makes them statistically significant. But I found that just to be interesting. I really can't make any inference on it based on the numbers that I have or the resources that I had to work with over the summer, if that makes any sense at all. But I just thought it was an interesting statistic here that I had, and I wanted to share with you. And the Red Lake Reservation up north here. So this, there could be many factors as to why these could be darker. I mean, yes, the American Indian populations are greater in the reservations, obviously. So when you have a higher population in one area, you're obviously going to have more that are not meeting the criteria, your standard bias you have in your selection. But all healthcare systems are trying to meet the goal of 80 by 18, meaning that they want 80% of all people to have their colorectal cancer screening up to date by 2018. Now, when I was looking at the numbers, when I took this region, because I had a whole bunch of zip codes, when I took this region around Leech Lake and I looked at the numbers that were overdue, it wasn't anywhere near 80%. We were actually hitting about 70%. So we have a 10% gap of where we are and where we need to be by 2018. So that was a whole piece of my project, is to kind of narrow down, okay, this is where the problem is. Here's the resources we have. These are where we need to grow. And I'll go into that a little bit more. That was my data piece. Now for my collaborations, I really reached out. I think teamwork is such a great tool, and it saves a lot of money in the end for everybody. And when we have a whole bunch of different organizations working on the same thing but not working together, it's a really big waste of resource. So I felt that it was an important piece of my project to reach out to these other experts and organizations that are working on the same issue. So one of the first organizations I reached out to, or not organization, I should say, I more specifically reached out to one person, I reached out to Joyce Saylor. I met her at the Dakota Medical Foundation conference in Minot this year, and I met with her right at the beginning, and she was so helpful with getting me in the right direction and looking at where I need to go with my project and stuff like that. But there was one piece of information that she gave me that was really important to how I really went forward with my project, and she told me that you cannot do blanket programs with American Indians because every tribe has its own culture, and that what may work for one tribe may not work for the other tribe, and most likely will not work for the other tribe because their tribes are so different and they have such different cultures, even though that they may be from the same origin. And it really, you need to really have a personal relationship with each and every tribe to get a widespread program to go through. So I felt that was a very important piece, and not a lot of people know that. They think that they can just throw out a program and it can be perfect fit for everybody, and that's really not the case with American Indians. So then I met with the NDSU American Indian Public Health Resource Center, and they gave me a wealth of information. They were really excited about my project, and they wanted to hear, I'm actually going to be using it for my master's paper. So they wanted to have my final project because they're like, there's just not enough information out there about this, and it'd be great to have something that's such area specific to our region. They gave me a lot of resources and would be willing to help with anything that I needed. The American Indian Cancer Foundation, I reached out to them because they have an actual project going on right now that's working to connect hospitals with more resources to get higher American Indian colorectal cancer screening rates. And so I'll come back to that later. They were a big help in one of the pieces that I'll explain later. And then I contacted the American Cancer Society, and they have programs going out around to reservations to help community health representatives help their communities or their tribal communities get the resources they need to get their screenings done. And, meeting with these people, it wasn't so much as they were helping me with one particular thing throughout my project, but it was more or less opening up that dialogue between these, with these organizations and experts in the field to Sanford to build that relationship and work together in the future. So like, for example, North Dakota Cancer Coalition, we wanted to get a Sanford representative on that board to work, since Sanford is such a major player in the North Dakota healthcare system. American Cancer Society wanted to reach out and get a stronger relationship with Sanford to see how they can help or how they can work together to meet goals and stuff like that. That was really the big important piece that I wanted to try, just opening up that dialogue and making sure, or seeing if those relationships would stay in. So hurdles that I experienced through this my big one was the waiting game. I started in May, and knowing that Sanford is such a huge system, that I'm such a little peon working, that there's a lot of agendas going out there, and everybody wants everybody to work on their agenda. So I put my report request in May. I got it back in July. So I only had a month to work with my data. The other thing too was just waiting, cold emailing people and waiting for responses and doing multiple emails, setting up meetings, waiting for those meetings, waiting for answers back on my questions. It took a lot of patience in order to get what I wanted out of this summer. But I learned a lot from it, because you have to really realize how to be self-sufficient with your time and knowing when to ask and who to ask. Am I getting an answer back? It was a really great skill to learn over the summer. So, yes, it was a little burdensome, but in the end, I'm really grateful that I did have to spend a little time, because that'll only go on to help me in my future career. So here I'll talk about some of the accomplishments I had over the summer. So back when I was talking about the American Indian Cancer Foundation, they were talking about or they have a project going with helping hospitals connect to tribal areas and stuff like that. So we had done some research on their website and found out that they had created a pamphlet that was American Indian specific for colorectal cancer. So we had brought up the question, wondering if, so when you go to the doctor nowadays, we have our electronic medical records, and based on what you're seeing at the doctor for that day, at the end of the visit, they will hand you a couple pieces of paper with some education on, for whatever reason that you came in that day. So we were looking through that education, and we found that we really didn't have any American Indian specific colorectal patient education in the EMR. So I made that task of mine, and right now I got in contact with the American Indian Cancer Foundation, got their approval to use their material, and now it has been approved through them, and it is now awaiting approval through the legal department of Sanford. I find this to be a really big accomplishment because, this is just one piece of education, and this could open the door to have a lot more pieces of education that are American Indian specific. Next week on Thursday, I will be attending the Bemidji Sanford Powwow for Health, and I will be educating American Indians on colorectal cancer up there using our new patient education that we have gotten permission to use. So I'm really excited to attend that because, well, A, I've never been to a powwow before, and B, I think it'd be really closing mark to get out in the community and promote my work that I've been doing all summer. So the other thing that I accomplished was that I recognized that in Bemidji they were having issues with patients not scheduling their appointments, and we found out that the patient's actually in charge of calling the endoscopy department who does the colonoscopies. And we found out that much research backs this up, where patients don't call to make their appointments for their colonoscopies. That just doesn't happen. It's actually more effective if the endoscopy department calls the patient to make the appointment. So we're in the process of changing that. And then one piece of my project that's kind of coming up here at the end is I will be calling all the no-show colonoscopy patients. So all those patients that didn't show up for their colonoscopies, I have a script set up, and I'm going to call them and just kind of ask them why they didn't show up and see how we can change the process at Sanford in order to meet their needs. So after I've collected all my data and stuff like that, I had a couple suggestions for the future and where to take this. I would think American Indians are their trust is hard to gain. But once you gain it, you have it, and that they trust you. So I was thinking that developing a navigator program where there's a specific person that has a relationship with these American Indians is able to go into their community, promote colorectal health, and then take them through all the paperwork, the whole process, see them through until their colonoscopy or whatever screening is done. Would be a great program to start with this, because I was looking through the process, and specifically when the process has to go through an IHS facility, that's when things get really complicated. So just because of all the paperwork and the approvals that have to go through, and it's a very intimidating process. I was intimidated myself, so I was like, no wonder these people don't want to get their colonoscopies done. It's such a pain in the butt. No pun intended. But I've been thinking that a navigator program would be really useful to this particular population, and that if Sanford wanted to look into, and it just wouldn't have to be a navigator for colorectal health. It could be a navigator for multiple things, just because, somebody to guide them through the process. It's so much easier when you have somebody there holding your hand, walking you through, making sure your questions are answered and stuff like that. So with that, I think stronger relationships need to be built with the area reservations. That could be reaching out to the community health representatives that work within the tribal community every day, maybe even bringing them on in Sanford and working together to improve the health of the entire community. I think more research needs to be conducted to learn more about the American Indians that are not in the Sanford system. Like I said, I only had total I had like 970 non-Caucasians hit my report, and 630 of those were American Indians. So there's a lot more than 630 American Indians in the entire northern region. I mean, we have some large American Indian reservation populations in this area. So, is the rest of the population getting the colorectal health their colorectal health addressed? What else is out there? I mean, I would have loved to explore that more, but I only had so much time during the summer to work on that. And then I think just continuing to make sure that the care that's offered at Sanford is care specific. Sorry, that's a typo. More cultural specific to the American Indians. What you and I may think is appropriate in the clinic office or in the doctor's office may not be appropriate to them. Just really taking the time and looking at what's appropriate, what's not appropriate when dealing with this culture. So my questions left to answer. I learned so much over this summer. I not only with my project, but also with just following Mallory and Dr. Tweed around in the quality department of Sanford. I learned that, before I always had this dream of going to medical school, but now that I've gone through the master's program, I've found a niche I like. I don't know that I would want to go on to medical school. I feel that I can have a greater impact with making healthcare, or helping healthcare make the transition to a more public health, population health based practice. I just, I see I'm already at the 20-minute mark, but the enthusiasm and the passion that I've gained over the summer about what I'm doing with my career and the integration of public health into medicine is just so immense that I just want to shout it to the rooftops, because the power of what's being done in the doctor's office with specifically one individual patient, and how that can transition into making populations healthier is just mind-blowing. And the work that's being done and the top-notch research that's being done with Sanford and around the nation is just remarkable. I'm super excited to continue my career in public health, and with what I've learned this summer, I plan to move mountains, I hope to move mountains in the healthcare industry and moving it to a more population health based practice. I really enjoyed this summer. I wouldn't change any of it. I had so much fun learning and experiencing public health in the healthcare field. I hope all of you had the same experience that I did, and I hope you guys have a great rest of your summer, and I hope to see you in the future. Thank you.